In the old healthcare model, patients would see their primary care provider, and then if they needed to see a specialist, they would be referred out, and that would be an additional day, an additional time off work, additional appointment.
When somebody is not feeling well, they have a hard enough time just getting to one place. I hear this from patients all the time. Since starting my first practice in Lincoln in 1998, it's always been my vision and dream to provide all-encompassing care on an outpatient basis for patients. The vision really has been, how can we lead to the best brain functioning care and treatment and bring innovative treatments to Lincoln and the community.
Alivation has great integrated care for its patients. We have behavioral health, which was the start of the company, and then we've also brought in primary care, which is a family practice clinic, neurology, and a pharmacy. And we also do research as well. So the patients get all kinds of different treatments that they need in one place.
We are very focused. Our core is brain health. To have maximum brain health, you also have to have maximum personal and physical health. So we're really looking at care, functioning, innovation, and wellness across the spectrum.
My name is Peter Vu. I'm one of the pharmacists here at Alivation, and I've been here since 2016. I've always been a person that's always wanted to care for individuals, so this is something that is near and dear to my heart, that I enjoy coming to work here to be able to take care of patients as if they're my own family.
My name is Jen, and I'm a patient service specialist here at Alivation Health. Being around people is what brought me to Alivation. Every single day, there's something that touches my heart, and I'm able to touch someone else's heart. That feeling of genuine care is really important.
It's important to me to take care of the entire patient, mind and body, because when you're taking care of primary care issues, so let's say a patient has high blood pressure, well, you have to think of all of the reasons that they may have high blood pressure. They may have high blood pressure because they're anxious. And so being able to treat their high blood pressure and then refer them on to see one of our behavioral health practitioners to help them with their anxiety is a huge benefit to the patient.
One of the unique things here at Alivation Pharmacy is we're able to customize our services for the patient. A lot of patients are not compliant with their medication because they do have pill burden, and it's difficult to keep track of when they should be taking it, how often they should be taking it. So with the bubble pack, what we call our disc pill, they can just open it and take the medication during the time frame in which they need it. We try to make everything easy for the patient. We also offer mail order and local delivery.
We're different from other healthcare practices, I think, because of the breadth of offerings we have, and also that we're continuing to move forward. So we have a lot of research studies available looking at either transcranial magnetic stimulation or other medications that aren't out there on the market but might be available through our patients through research.
Alivation is different from other places that I've worked because they really embrace teamwork. I know that I can go to anyone here if I ever need anything. We all have the same goal, which is to take care of those patients and make sure everyone leaves here happy or feeling like they're cared for.
We're all focusing on the patient, what's best for the patient.
I'd say my job is very fulfilling because I get to do one of the best things in the world, is that I get to help people to feel better.
So when a patient walks through the doors for the first time, they're going to be greeted with a warm smile and just quickly get to understand that we are here for them.
I hope a patient leaves Alivation for the first time with a sense of relief, possibility, hope, and that I can get to the next step.